Hey everybody, we are going to be watching a video by one of our patients, Ariel. She posted on her YouTube channel when I did Botox or Xeomin on her for wrinkles on her forehead and all. So we're going to watch it together and we'll see, give it the thumbs up, I'm sure. We're very happy that she posted it on her YouTube, so let's check it out. We're here with Ariel. We're happy that she came in today. We're going to be doing a little Botox / Xeomin on the crow's feet for this area. It's my little preamble explaining what we're going to be doing. Oh, she even included our logo. Just basically any wrinkles that are due to overactive muscles, that's where you use what are called neuromodulators, which you've heard of. Neuromodulators is the fancy term for Botox and Xeomin, Dysport, and things. Those other products you may have heard of in the past. Also is Botox or Xeomin or Dysport. She even included my Master's of Public Health at the end of my name. Oh, that's a cool logo. What is that called? It's like a drop video or something. It's just whenever your logo flickers like that. That's very cool. Actually, I had a guy that came in. He said he was going to make me one of those videos if I took off a cyst off his leg, and I took it off, and that was like I kind of sort of knew him through a patient, and so the deal was I was going to take off the cyst, and he was going to make me one of these cool videos, and he never made me the videos, so he owes me $500, but never heard from him again. Kind of rude. It's a true story.
To my YouTube channel. Today we are going to be doing a little bit.
Make sure you go and subscribe.
Of Botox and some under eye filler, and I just wanted to show you guys what that was like. So as you can see, I have a little bit of crow's feet, and then right
like her
here
nail color.
I just want to fill this out.
Kelsey would be proud.
Basically it will help with the hollowness underneath my eyes to reduce eye bags.
So this is pretty cool. So my wife likes to get the filler under her eyes. She's actually put it on her Instagram before. And so this is actually where Ariel saw it. That's why she knew she wanted to get filler under her eyes to fill out the dark circles in her eyes. So let's continue. One other thing with getting Botox, as far as that chemical, putting that into your body, this has been around since 1992. There's been no long-term effects seen in anybody who gets Botox. Other than sometimes it just stops working, whereas, again, that's not as much of an issue as Xeomin. But anyway, it doesn't take much. It's 10 units on each side, and 10 units does not mean 10 injections. It's just actually 1, 2, 1, 2. Use a super small needle. A lot of doctors use a 30 gauge needle. We use a 33 gauge, so even though it's a bigger number, it's actually a smaller needle. She sometimes gets nervous, even though it really doesn't hurt. So we give her some breast implants to squeeze on as a little stress. This is the greatest idea I've ever had. Unfortunately, it's the best idea I've ever had. Patients come in, they're nervous, and instead of giving them a stress ball, give them a breast implant. Mostly because they're mostly distracted by the breast implants because they've never really squeezed them before, and they're really cool. Silicone breast implants. Adults, kids, everybody loves squeezing them. Relievers. I'm going to clean you up first with an alcohol pad. You can see like little blood vessels. We want to obviously avoid those to avoid any bruising. So we'll just go in right here. Really tiny needle. I don't know how it compares to like acupuncture needle, but it's pretty small. And do like 5 units. So 33 gauge needle, so pretty small. And that is it for the right side. Yeah, just 2 injections. Cool. Now we're going to give her an ice pack here in just a second, just to minimize any chance of bruising. Okay, so we're going to go and do the other 2. By the way, great camera work. Shout out to Jan. Units on this side. She's got an ice pack on that right side. And you'll notice also after I do the injection, like I said, 5 units per injection, so a total of 10 on the crow's feet. And then I'll massage it. Sometimes you'll read online you're not supposed to massage it because it'll make it go someplace else. It's an old wives' tale that you're not supposed to massage it, or it's an old wives' tale that you're not supposed to work out afterwards. It's not like sauce in a saucepan. It doesn't slosh around. So you can just put it. So hopefully you got that. It's not like sauce in a saucepan. It doesn't slosh around. People always tell you don't lay down, don't work out after you get in Botox or Xeomin, whatever. It's not true. However, I guess I've been doing this 13 years. I've never had somebody come back after working out and like the Botox went someplace else and made their eyelid droop. It just doesn't happen. Right there, it's going to stay there. Massage it to get it down into the muscles so it'll last a little longer. But then afterwards, that stuff about not laying down or not bending over or not working out, it's all nonsense.
What's the crunch that everyone talked about?
Oh yeah, the crunch, you can really hear it if we're doing the forehead. When you're going in with the needle, you can actually hear a little crunch. That's actually a good sound. It weirds people out a little bit, but it's a good sound. It just means I'm getting into the muscle where this is going to be most effective and last the longest. So in review, the crunch is good. The sound of the crunch of the needle going into the muscle, it's good. It makes the product last longer. Hopefully you'll start to work in 1 to 3 days, hit its maximum effect at 7 days, and last 3 to 6 months.
A lot of people were asking me about the chemicals being injected, like if it's bad for you.
Yeah. So it is a toxin. Can't get around that. It's Botox. It's a botulinum toxin. It can make a newborn under the age of 6 months really sick if they. That's why you don't. Those kids don't eat honey because it can have botulinum in it. And so it is a toxin. But for adults, when we're using it here, the toxin is there. It goes in and relaxes the muscles. That's how it works. For what it's worth, Botox has that botulinum toxin in it, and then it's got this extra protein around. Pay attention to this, is really important. But it's an inactive protein that makes it a little bit more unstable. So that's why Xeomin is also a good product to use because it doesn't have that extra protein. So it's easier to store and everything. And also there's a risk of something called secondary non-responders. It's people who are getting treated with Botox, and then after a bunch of treatments they stop responding to it. They think it's because your body develops antibodies to that extra protein around the Botox molecule, whereas Xeomin doesn't have that protein, that extra protein, so people don't become secondary non-responders, meaning that if it works when you're getting Xeomin, you're always going to have a result of that, whereas Botox you can become a non-responder where it just doesn't work and you spend the money on it and it doesn't work. So just to clarify, I'm a speaker for Merz, the company that makes Xeomin, so full disclosure, but there is some potential truth out there about the fact that people who develop antibodies to the Botox molecule, the actual brand Botox, that they can stop reacting and responding to Botox, whereas that doesn't seem to happen with Xeomin because it doesn't have that extra inactive protein that Botox has. You would think that an extra protein would make something better or more robust, but it actually is could cause a problem with Botox and that you stop having a result from it because the antibodies develop towards that inactive protein. Okay, on to the next thing we're doing. Ariel is getting a filler under the eye, so people who have sunken eyes or the dark circles under their eyes, that is can be treated with fillers. So basically the dark circles under your eyes, it's not like dark pigment, it's just really that your lower eyelids are in the shadow of your eyes. So in the shadow, so what we can do is we can do filler injections to the under eye area, bring that out from under the shadow of the eyes, and that gets rid of the dark circles. Used to, you'd have to have surgery to get that treated, but now you can do fillers. You might have seen my wife getting it, me doing that to my wife. So if you're worried about who should get this, if I can do it to my own wife, then I feel like it's pretty safe to do to anybody. But anyway, we're going to use this Bellaterra. I'm going to show you the whole box. Bellaterra is a hyaluronic acid filler. Hyaluronic acid is a gel. It's like the same gel that's in your joints, like your knee joints. They've just synthesized it. I don't think that picture frame behind me is crooked, but it sure looks like it in this video. Well, we do live in an earthquake-prone area, so maybe an earthquake came and shook it crooked. And so what we're going to do is we're going to take this filler. It's 1 cc. Most fillers come in 1 cc syringes. It's clear. We're going to put it underneath the eye to help bring out the sunken areas out from under the shadow of the eye to get rid of those dark circles. Okay, Bellaterra, it's a filler. Any hyaluronic acid filler like Juvederm, Restylane can do this too. It was really bothering me. So if you look under the eyes, a little bit sunken in. It may not come through on the video here, but area is a little bit dark right here, and that's just because the eyes are a little sunken in right there. It's not terrible by any means, but we're just going to fill in the filler here. Now, one of the things that we can do is when we do the injections, sure, there's some pain associated with the needle, even more pain associated if you're doing lip filler. And so for lip filler, what I'll do is I'll do a dental block first, same thing you would do at a dentist where they inject a xylocaine or lidocaine or whatever they call it, where they inject it on the inside of the mouth. And that numbs up the middle part of the face so you won't feel the injections in the lips. Now, I know not all doctors do that, but I'm just saying that if you're going to get fillers and they're painful, just remember they don't have to be painful. We can do a dental block, numb up the whole middle part of the face. But with the under eyes, we can do the filler here, and it's less painful with these needle injections as opposed to doing the dental block. So I'm just going to cleanse the lower part of the eye with the alcohol pad. Really small needle, and we're just going to go in here, and we go in, and I'm actually tapping on the bone with the needle tip. Okay. So I injected a little bit. I'm just going to massage it in there now.
It's not too painful. It just kind of feels like pressure.
Good feedback. So anyway, so I've already injected there. So now I'm going to make my way along the orbital rim of the bone around the eye socket. So I inject a little bit more there. And what I'm doing is I'm going through skin, going through muscle, and then tapping on the bone and injecting on the bone. And the reason I'm injecting down deep is because I want this to fill in evenly so she doesn't have any lumps or bumps.
little bit more on this side, then we're gonna go to the other side.
And even if this seems like it's taking a while, it's just because
Kinda
we're
hit the
explaining it.
crotch on
The
this.
Botox takes like
Good.
literally
That's
15
good. So you can
seconds,
see,
and the filler can
other
take
than
maybe
maybe
like
seeing a
1 or 2
little bit of the
minutes.
needle stick, there's no bleeding, and hopefully no bruising. We're gonna go to the other side and put an ice pack on this side while we're waiting. Okay, now we're going to this side while she's holding the ice pack on that side. We're gonna start over here. There's a little blood vessel I can see under her
She
eyelids.
did a great
We're
job
gonna
with
avoid
editing.
that to minimize the chance of causing a bruise.
I think
Good to
Ariel's
have
found
this
her-
stretcher right
her
on the
purpose.
bone, not trying to rush through anything.
Videographer extraordinaire.
Again, you can maybe hear that crunch. That's good though. It just means I'm under the muscle.
Here's the little like a little bit of pain. She's trying
Sometimes when
to
it's
hold
painful,
it
means
together
you
for
maybe
me.
hit a blood vessel that's might cause bruising, but we didn't there, so that's good. So it's just normal pain.
And it would be potentially more painful if I hadn't done the dental block. So at least this takes the edge off by numbing them up like a dentist
Go to the eye
would.
socket. Just massage that in. Making our way around here. That's it. We're done. You did awesome.
So that was it. Pretty much it's not very sore. It's a little tender on this side, but for the most part,
No bruising.
it's pretty good.
Look at that. You can't even see
So
like
if
the
you
needle
like that
sticks.
video, please be sure to subscribe so you can watch more. Go ahead and hit the notification bell so you can hear more about it. And if you want to find out more about pricing and if you have more questions about any of the procedures that I had done, please be sure to check out Pacific Heights Plastic Surgery, and I'll link them below.
Oh, that was nice. Thanks for the shout out, Ariel. That was great. She did an awesome job. I've really got to figure out this drop video that she does. That's with the logo. Very cool. All right. Thanks for joining us. Hope you enjoyed that. Hope you learned something from Ariel and me a little bit. And if you have any questions, feel free to message us at Real Dr. Bay, RealDrBae on Instagram, or you can even text us and ask us a question at 415-923-3005. But for sure, subscribe to Ariel's YouTube page, which is right here.